In 3, 2, 1. Bladder stones. That has our interest this week. As every Monday, Wednesday, and Friday on Eagle Country 106.3, we do pet tips. It's sponsored by Town and Country Veterinary Clinic on State Road 100 in downtown Stark. You're just shaking your head. All right.
What did you want me to say?
Yeah, well, we could have put you somewhere else, but then you'd have to make a telephone call. Yeah. Good morning, Doctor.
Good morning. As always, a lot of times, we come up with our topics for pet tips based on what I happen to be seeing a lot of lately, and we happen to be seeing quite a few bladder stones here recently. And so when we're talking about bladder stones, we're talking about actually a little hard rock-like object in the bladder. Now, this is one of those things I always talk to people. Say, yeah, my dog had kidney stones. Well, they might have, but kidney stones, unlike with people, kidney stones are the norm. Okay, dogs, they're not. We see probably 100 cases of bladder stones to 1 case of kidney stones in dogs. Okay, and so typically, if your dog has stones, more than likely, it's bladder stones. You just heard kidney stones, okay, because that's what we know. But so the bladder stone basically forms under what we call a super saturation state. Okay, so have you ever made rock candy?
Sure.
Okay, so what you do is you take the boiling water and you dump the sugar in there. And the reason the water is boiling is so you can actually get more sugar dissolved than you'd be able to get dissolved at normal body temp. And then what you do is you put your stick or your string in there, and then you bring the temperature down. And what happens then, the sugar starts to come out of solution, and because the stick or the string is there, it creates a nidus for them to form. And then you get the pretty little formations that people sell or whatever, but basically it's sugar, okay? And that's exactly how bladder stones form. Okay, now obviously those aren't very tasty, okay? So, because it's not sugar, but it's dealing usually with magnesium and phosphorus or calcium and those things, but it's the same phenomenon. The body produces a urine that is oversaturated in those elements, and then say bacteria or some cells slough off, and that creates your stick or your string, and then they'll coalesce. Now, what will these dogs look like? And the reason I brought this up, because we've had a couple here recently where we get a dog that comes in, it's got a UTI, some bloody urine, and most of the time we're not off to the races x-raying everybody, okay? So we'll put them on an antibiotic, we look at the urinalysis, and sometimes you'll see crystals, sometimes you won't, okay? And so we'll check these, and you put them on antibiotics, they get better. And then they come off the antibiotics, so within a couple weeks, they're having bloody urine again. That's a huge tip-off that you need to then be taking images. And x-rays and ultrasound are 2 of the imaging modalities we use to spot these stones. And the good news is the majority of the stones are very readily visible on a straight-out x-ray. Shoot the x-ray, you see the stones, and even then we can measure and tell how many are there, what size, all that kind of stuff. And depending on the kind of stone, then we then decide whether we surgically intervene or if we use diet to try and dissolve them. And there's a couple options with that. Usually the shortest distance between 2 stones is to surgically remove them. But again, if you've had repetitive urinary tract infections, your pet, and they treat and they get better for a month or 2, but then they keep coming back, it might be a good idea to get some further diagnostics or images done.
Sounds good. We'll be back right after this.